The fluorescent lights hum at a frequency that never changes. It's 2:47 a.m. in Metro General's emergency room, and Dr. Leah Grant stands at the supply closet, counting IV catheters for the third time this week. Her hands move in practiced rhythm. 14 gauge, 16 gauge, 18 gauge. She logs each one in neat handwriting, her pen moving with precision that seems excessive for such a mundane task. Behind her, Dr. Marcus Holt leans against the nurse's station. His voice carries across the linoleum floor, loud enough to ensure she hears every word. Grant's on inventory again, he says to a medical student whose name he probably doesn't know. Guess that's what happens when you graduate from a program nobody's heard of. The student shifts uncomfortably, doesn't laugh. Marcus continues anyway, his tone casual and cutting in equal measure. Leah's jaw tightens. Her pen pauses for half a second. Then she continues counting. 20 gauge. 22 gauge. Her expression doesn't change. She's 34 years old, compact frame, dark hair pulled back in a simple knot, tired eyes that see more than they show. She's worked at Metro General for 18 months, always taking the worst shifts, the menial tasks, the rotations no one else wants. No one asks why. She doesn't volunteer answers. At 3:12 a.m., the automatic doors burst open. Paramedics wheel in a gurney at speed. Male patient, mid-40s, seizing. The sharp smell of alcohol precedes him. Leah's the closest to the bay when he arrives. She moves without thinking, her body responding before her mind catches up. Airway first, head tilt, jaw thrust. Her hands position his skull with muscle memory that seems to come from somewhere deeper than textbooks. Step back, Grant. Marcus pushes past her shoulder, claiming the space. I've got this. She steps aside, doesn't argue. Her hands drop to her sides, loose and ready. But she makes no protest. Marcus fumbles with the airway. Once, twice. His hands shake slightly as he tries to visualize the anatomy, get the angle right. Leah stands 3 feet back, watching. Her eyes track the monitor. Oxygen saturation dropping. 86%. 83. The patient's lips are turning blue. Nurse Rachel Kim glances at Leah, just once, a question in her eyes. Leah shakes her head, a tiny movement. Not yet. Marcus finally gets the tube in on his third attempt. The patient's stats begin to climb. Oxygen saturation rises. The seizing stops. See? Marcus grins at the medical student, pulling off his gloves with a snap. Textbook placement. You just have to stay calm under pressure. The student nods, still looking uncertain. Leah turns and walks back to the supply closet. Rachel watches her go, something thoughtful in her expression. At 4 a.m., Leah takes her break in the stairwell. The concrete is cold beneath her as she sits on the third-floor landing. She reaches into her scrud pocket and pulls out a small metal coin. It's worn smooth. No markings remain, rubbed away by years of handling. Just weight, just memory. She turns it between her fingers, closes her eyes. For a moment, she's somewhere else, dust in her mouth, the sound of rotors fading into distance. A voice calling her name with urgency she can still feel in her chest. She breathes, counts to 5, opens her eyes. The stairwell is quiet, just the hum of the building's ventilation. She slips the coin back into her pocket. Rachel finds her 10 minutes later, pushing through the stairwell door with 2 cups of coffee. You okay? Fine. Rachel sits beside her, close enough to be present, far enough to give space. She hands over one of the cups. Leah takes it, but doesn't drink. You know, Rachel says after a moment, her voice quiet, I've been a nurse for 16 years, worked with a lot. Teat of doctors. She pauses. You move different. Leah doesn't respond. Her fingers wrap around the cup, absorbing the heat. Not wrong, Rachel continues. Just different. Like you've done this somewhere else. Somewhere that wasn't a hospital. The silence stretches. Leah takes a slow breath. I trained the same as everyone else. Rachel nods, doesn't push. She stands, collecting her empty cup. Okay, she says simply. Then adds, just so you know, different isn't bad. She leaves Leah alone in the stairwell. At 5:30 a.m., the shift ends. Leah strips off her gloves and tosses them in the biohazard bin. She walks to the locker room, her movements economical. No wasted motion. Marcus passes her in the hallway, his bag slung over his shoulder. Hey Grant, thanks for handling inventory tonight. Really freed me up to focus on critical cases. She nods once. Sure. He doesn't see the way her fingers curl briefly, the breath she holds for 2 seconds before releasing, the tiny muscle that jumps in her jaw. He never does. In the locker room, Leah changes out of her scrubs, pulls on jeans and a jacket. When she opens her locker, a photograph is taped inside the door. 3 people in tactical gear, faces obscured by distance and dust. She looks at it for 5 seconds, then closes the door. She walks out through the ER. The morning shift is arriving. Bright voices, fresh energy. She slips past them like a shadow. Outside, the air is cold. Chicago wind cuts across the parking lot. She unlocks her car, a 10-year-old sedan with a dent in the passenger door. Before she gets in, she pauses, looks back at the hospital. 6 floors of concrete and glass, lights burning in windows. People inside saving lives, making mistakes, learning, forgetting. She gets in the car, starts the engine, drives home in silence. The coin sits heavy in her pocket, a weight she carries. A reminder of something she can't quite name and refuses to forget. Leah drives through empty streets as dawn breaks over Lake Michigan. The city is caught between night and day, streetlights still glowing against the orange sky bleeding across the water. She parks outside a walk-up apartment building in Pilsen. 3 floors, narrow stairs, chipped paint on the handrails. She climbs without touching them, her footsteps silent on the worn treads. Inside her apartment, she sets her keys on the counter with precision. 1 room, minimal furniture, a bed made with corners so tight a coin would bounce. No photographs on the walls. No personal items visible, except a single bookshelf with medical texts arranged by subject. She notices her hand shaking as she reaches for the light switch. Still, the shower runs too hot. Steam fills the small bathroom within seconds. She doesn't adjust the temperature, just stands under the spray, letting it burn. On the tile wall, condensation forms and drips. She watches the pattern. Her mind slips, sand in her mouth, the metallic taste of fear. A boy no older than 14 on a stretcher, his chest open, her hands inside, moving with desperate speed. Someone screaming coordinates. The helicopter bucking through hostile airspace. Her voice steady despite everything. Clamp, now. She blinks. The water has gone cold. She doesn't know how long she's been standing there. She gets out, dries off, dresses in clean clothes that smell like detergent, and nothing else. At 9 a.m., she should sleep. Her body is tired, but her mind won't quiet. She goes to the gym in the building's basement. It's empty, old equipment, concrete floor, a heavy bag hanging in the corner. She wraps her hands with practiced efficiency. The movements are automatic. Loop around the wrist, across the knuckles, between the fingers. Tight enough to protect. Loose enough to feel. She faces the bag, breathes. Thus, then moves. Jab, cross, hook. Her form is flawless. Weight transfers from back foot to front. Hips rotate with each punch. Breath expels on impact. No wasted movement. No hesitation. An older man enters the gym. Gray hair, faded navy tattoo on his forearm. He heads for the weights but stops when he sees her. Leah doesn't notice. She's somewhere else. Kandahar, a makeshift ring outside the medical tent. Operators with too much adrenaline and no mission for 36 hours. One of them teaching her to fight while they waited for extraction. You're too tense, Doc. I'm fine. You're thinking. Don't think. Just move. She throws a perfect liver shot. The bag swings hard on its chain. The old man raises both eyebrows, watches for another 30 seconds, then leaves without saying a word. Leah works the bag for 20 minutes. When she stops, her knuckles are red beneath the wraps. Her breathing is controlled, even. She unwraps her hands slowly. In the mirror, her reflection looks back. Same tired eyes, same expressionless face. But her shoulders are looser now, the tension drained into the bag. She goes back upstairs, lies down, sleeps from 11 o'clock a.m. to 3 o'clock p.m. Dreamless, efficient. Her phone wakes her. A text from Rachel. You working tonight? Leah types back. Yeah, good. Holt's on a power trip. Needs a reality check. Leah almost smiles. Almost. At 6 o'clock p.m., she's back in the emergency room. The evening shift is chaotic. A multi-car pileup on the expressway. Patients flowing in steady. The organized chaos she knows how to navigate. She ties her hair back, checks her pockets. Pen, Stethoscope, trauma shears. She pauses at the shears. They're not standard issue. Black oxide coating, serrated edge on one blade. Military grade. She bought them at a surplus store 2 years ago. Told herself they were just tools. They're not. Rachel sees them once when Leah's cutting through a patient's jacket. Heavy denim that civilian shears would struggle with. Leah's cut through it in one smooth motion. Those are intense, Rachel says. Leah doesn't look up. They work. Rachel files it away with all the other small observations. The way Leah stands with her back to walls. How she tracks everyone in a room without appearing to look. The fact that she never startles, no matter how sudden a noise. At 8:47 p.m., a coding patient arrives from a motor vehicle accident. 26-year-old male. Blunt chest trauma. No pulse. Marcus takes lead. He's barking orders. Chest compressions already in progress. Epi, now. Already administered, Leah says quietly from her position at the medication cart. I didn't ask for a status report, Grant. She steps back, lets him work. But she's watching. Always watching. The patient's pressure drops. Marcus orders another round of compressions, calls for the defibrillator. The paddles charge with their distinctive whine. Clear. The patient's body jerks. The monitor shows asystole. Flatline. Leah's fingers tap against her thigh, a rhythm only she can hear. She's counting. 5 seconds. 4. 3. Fluid bolus, she says, not loud, just clear. I know what I'm doing, Marcus snaps, but his hands fumble with the line. Too much adrenaline. Not enough muscle memory. Leah's already moving. She doesn't ask permission, just pushes the saline herself. Fast, clean, proper technique that comes from repetitions Marcus has never had to do. The pressure climbs. Not much, but enough. Marcus glares at her. Stay in your lane, Grant. Copy, she says. The word hangs in the air. Military, automatic. She catches herself, but it's too late. Rachel heard it. Her eyes narrow slightly. That's 3 times now. Small slips. Tiny fractures in the civilian facade. The patient stabilizes enough for transport to the ICU. Marcus strips. Sees off his gloves. Could have done without the interference, he mutters. Leah says nothing. Just charts the procedure with precise handwriting. At 11 p.m., Rachel corners her in the break room. The door closes. The fluorescent lights buzz overhead. Where did you really train? Leah pours coffee she won't drink. State school. You know that. That's not what I'm asking. Leah's hand stops. The coffee pot hovers over the cup. You move like someone who's worked under fire, Rachel says. Her voice is gentle, but firm. Real fire, not just a busy ER. Leah sets down the pot, doesn't turn around. I haven't. Leah, I did my residency, same as everyone, passed my boards, got licensed. That's it. Rachel studies her back, the rigid spine, the shoulders that won't relax. Okay, she finally says. She leaves. The door swings shut. Leah stands alone in the break room, holding a cup of coffee that's already gone cold. Outside, an ambulance siren wails. Inside, the lights hum their endless song. She reaches into her pocket, finds the coin, turns it over between her fingers. The weight grounds her, reminds her why she left, why she stays hidden. She puts it away and goes back to work. It happens at 1:34 a.m. The call comes in hot. Mass casualty incident. Structural collapse at a downtown construction site. Partial building failure. Multiple victims trapped. First units estimate 6 to 8 critical injuries inbound. ETA 4 minutes. The emergency room transforms. Dr. Patel takes command from the center of the department, her voice cutting through the sudden surge of movement. All hands, trauma protocol, clear bays 1 through 4. Grant, you're on triage. Leah nods once, moves to the ambulance entrance. Marcus mutters to a resident, just loud enough. Great, she'll probably sort them by height. The resident doesn't laugh, too focused on prepping equipment. The first 2 ambulances arrive within seconds of each other. Leah moves between them with swift efficiency. A woman with a compound fracture of the left tibia, stable, Bay 4. A man with lacerations across his face and chest, conscious, alert, Bay 3. She's marking the 3rd patient when the sound hits. Sirens, different pitch. Paramedics shouting before the doors even open. The gurney crashes through at full speed. Male, mid-40s, construction vest, hard hat gone, and a piece of rebar, 3 feet long, penetrating his right chest just below the clavicle. Blood pools beneath him on the gurney. His face is white, lips pale, pressure dropping with every second. The lead paramedic is young, scared. We couldn't remove it. It's in deep. Pressure 70/40 and falling. Leah's eyes lock onto the entry wound, the angle of penetration. The amount of external bleeding versus what should be pooling internally. Subclavian artery. Trauma 1, Patel shouts. Now. Marcus and 2 residents converge on the bay. They're fast, efficient, following protocol. Leah steps to the side, watches from the doorway. Marcus focuses on the rebar. He's trying to stabilize it, pack around the wound. Standard procedure for an impaled object. Don't remove in the field. Secure it. Get to surgery. But his hands are shaking. The monitor screams its warning. Pressure at 65/38, dropping. We need to get him upstairs, Marcus says. His voice is tight, controlled panic. Pressure's 60/35. I know. Just stabilize the object and prep for transport. Leah's watching the monitor, the patient's color, the way his chest moves, the rate of external bleeding. The math is simple, brutal, clear. He won't make it to the operating room. 58/32. Marcus freezes, just for a second, but it's enough. Leah moves, fast, silent, no hesitation. Itation. Grant, what are you doing? Move. Her voice is flat. Command, not request. A tone that comes from somewhere deep and unarguable. Marcus steps back, shocked into compliance. Leah's hands are already in position. She doesn't touch the rebar. Instead, her fingers palpate the tissue around the entry point, tracing the angle, calculating depth, feeling for the arterial path beneath skin and muscle. Proximal control first. Her voice is calm, clinical, absolute. Rachel, I need 20 silk suture and a vascular clamp. Now. Rachel doesn't question, doesn't hesitate. She moves. Leah makes a small incision above the collarbone. 2 inches. Clean, precise. No wasted movement. Her fingers disappear into the wound, navigating by touch alone. What the hell is she doing? One resident whispers. Proximal arterial control, another breathes. That's a battlefield procedure. Leah's fingers find the vessel. She applies direct pressure. The external bleeding slows immediately. Pressure's climbing, 62/40. Clamp. Rachel slaps it into her palm. Leah doesn't look down. Her eyes are on the patient's face, watching for response, for signs of consciousness, for life. She isolates the subclavian artery, clamps it proximal to the injury. The movement is smooth, confident. The kind of confidence that only comes from repetition under pressure. 68/42. The rune exhales collectively. Stabilize the rebar. Don't attempt removal. Pack the wound. Get him to surgery now. Leah steps back, peels off her gloves. Her hands are steady. Vascular's going to need to repair the artery and check for additional damage. He's got maybe 90 minutes before ischemic injury becomes permanent. The team moves. The patient is wheeled toward the elevator. Still alive, still viable. The trauma bay goes quiet. Patel stares at Leah. Everyone stares at Leah. That was a combat medicine technique, Patel says slowly. Blind arterial control under emergency conditions. Leah drops her gloves in the biohazard bin. It was necessary. Where did you learn that? It's in the literature. It's not in any civilian training program I know. Leah meets her eyes. For a moment, something flickers there. Something hard and old and earned. The patient's alive. That's what matters. She walks out of the bay. The hallway is bright, quiet. Her hands are starting to shake now. Adrenaline catching up. She flexes her fingers, breathes. Rachel follows her out, stops a few feet away. Leah. She turns. That wasn't luck. That wasn't textbook. Rachel's voice is soft, careful. That was muscle memory. You've done that before. Leah's jaw tightens. I did what needed doing. I'm not arguing with you. I'm just saying I see you. They stand in the hallway. The sounds of the ER continue around them. Voices, monitors, life. Don't, Leah finally says. Don't what? Don't ask, please. Rachel nods slowly. Okay, for now. She walks back to the nurse's station. Leah stands alone. She reaches into her pocket. The coin is there, warm from her body heat. She doesn't take it out, just touches it, grounds herself. At the nurse's station, Marcus is talking. His voice carries. She just took over, like she's done that 100 times. A medical student shits uncomfortably. Maybe she has? Where? Her file says state school residency. 18 months here. Before that, nothing remarkable. He shakes his head. No one gets that good without serious trauma experience. Maybe she's just talented. No one's that talented. Leah hears every word. She turns and walks toward the break room. Inside, she sits at the small table, pulls out her phone, stares at the blank screen. She should feel proud, satisfied. She saved a life. Instead, she feels exposed. The coin comes out of her pocket. She sets it on the table, turns it slowly with one finger. Mosul, a convoy ambush, 6 wounded. She worked for 40 minutes straight with no backup, no proper light, just her hands and training and will. They all lived. She picks up the coin, puts it away. At 4 a.m., the ER quiets. The rush is over. Patients are stabilized or transferred. The overnight rhythm returns. Patel finds Leah at a computer, charting the procedure. I need to know. Leah doesn't stop typing. Know what? Who you really are. I'm an emergency physician. You're more than that. Leah's hands pause over the keyboard. She looks up. Does it matter? The patient lived. Patel studies her, really looks at her, sees past the tired eyes and the careful, neutral expression. For now, no, it doesn't matter. She pauses, but eventually it will. She walks away. Leah finishes her charting, logs out, sits in the glow of the monitor. She knows Patel's right. The clock is ticking. The shift ends at 7 a.m. Leah finishes her documentation, closes the last chart, and heads to the locker room. The hospital is transitioning, night staff dragging themselves out, day shift arriving fresh and loud. She's pulling on her jacket when Rachel appears in the doorway. You heading out? Yeah. That guy from last night, the rebar, he's out of surgery. Vascular team said you saved his life. Leah zips her jacket. They saved his life. I just bought time. That's not what they said. Leah closes her locker, doesn't respond. She walks out through the ER, keeps her head down, but she can feel the stares, the whispers. Word has spread. It always does. She's almost to the exit when she hears it. Doc. One word. A voice like gravel and smoke. West Texas drawl. Her spine goes rigid. Her hand freezes on the door handle. She knows that voice. She turns slowly. He's standing near the information desk. Older now than she remembers. Graying beard. Lines around his eyes. Prosthetic left leg visible below his jeans. But those eyes, sharp and steady, haven't changed at all. Jameson. His face breaks into a tired smile. Relief and recognition mixing together. Damn, I wasn't sure it was really you. Leah's throat tightens. Her heart rate spikes. Fight or flight response kicking in, despite years of distance. What are you doing here? VA outreach program. I work with the clinic upstairs, 2 days a week. He gestures at his leg. Lost this one in Helmand Province. You remember. She does. Too clearly. The blast. The screaming. His femoral artery severed clean through. Her hands slick with his blood. Working in the back of a helicopter while it banked hard to avoid ground fire. Stay with me, Jameson. Can't feel it, Doc. Can't feel anything. You don't need to feel it. Just stay with me. Stay. She blinks. Forces herself back to the present. I remember. Rachel is at the nurse's station, pretending to work on a computer, but she's watching, listening. Jameson steps closer, lowers his voice. I heard someone pulled off a subclavian clamp in Trauma 1 last night. Thought, no way, not in a civilian hospital. His eyes search hers. Then I saw your name on the assignment board. Leah's jaw sets. It was a standard emergency procedure. Standard. He almost laughs, shakes his head. Doc, I've seen you work in conditions that would break most surgeons. That wasn't standard. That was you. Jameson, don't. Why didn't you tell anyone? Why are you hiding here like you didn't do what you did? Because I left that behind. I'm not that person anymore. You can't leave that behind. It's who you are. His voice carries more than he intends. The ER isn't crowded yet, but there are enough people to hear, to notice. Marcus walks past on. His way out. He stops, looks between them with casual curiosity. Friend of yours, Grant? Jameson turns, sizes Marcus up in about 2 seconds, sees the ego, the posturing, the casual disrespect. You could say that. Leah doesn't really talk about her past, kind of a mystery woman. Marcus smirks. We keep telling her she should open up more. Something hardens in Jameson's face. Leah sees it happening, tries to intervene. Jameson, but he's already talking. His voice clear and deliberate. Not a mystery, just classified. The word drops into the space like a stone into still water. Marcus blinks. His smirk falters. What? Dr. Grant and I served together, overseas. She was a Tier 1 medical officer, JSOC. Silence, complete absolute silence. Rachel's hands freeze over her keyboard. A resident carrying a tablet stops walking. The unit coordinator looks up from her desk. Marcus laughs. It sounds nervous, uncertain. You're joking. Right? Do I look like I'm joking? Leah's face has gone pale. Jameson, stop, right now. But he's not stopping. He's looking at Marcus with something that might be anger or might be protective instinct. She held my artery closed for 30 minutes while we waited for extraction. No light, no backup, just her hands and a promise she made. He pauses. She saved my life. She saved 40 others, so maybe show a little respect. Marcus stares at Leah. Really looks at her for maybe the first time. You were military? Like actual combat? Leah doesn't answer, can't answer. Dr. Patel appears from the office hallway. She heard everything. Her face is unreadable. Dr. Grant, my office, now. Leah walks, doesn't look at Jameson, doesn't look at anyone. Behind her, Jameson calls out, I'm sorry, Doc, but they needed to know. The office door closes. Patel sits behind her desk, gestures for Leah to sit. Leah remains standing. Is it true? Leah exhales slowly. Yes. You were military. Combat medical. Yes. Why didn't you disclose this during hiring? Because it's not relevant to my current position. Not relevant? Patel leans forward. You have combat trauma experience that exceeds anyone in this hospital. Had. Past tense. I'm not that person anymore. Then who are you? Leah meets her gaze directly. Someone trying to do the work without carrying the weight of what came before. Long pause. Patel studies her carefully. Does anyone else know about this? No, just Jameson, and now everyone in the ER. Patel sits back, processes. Okay, for now this stays contained. But if I find out you've been hiding anything that affects your ability to practice medicine here. I haven't. Everything I did is in the past. I'm licensed, credentialed, clean record. Then we're done, for now. Leah turns to leave. Dr. Grant? She stops, hand on the door. That procedure last night? That was exceptional work. Leah doesn't respond, just leaves. The ER has changed in the 10 minutes she was gone. People are pretending to work, pretending not to stare. But the atmosphere is different. Charged. Marcus is still there. Leah walks past him without a word. Grant, wait. She doesn't stop. Jameson is waiting near the exit. He stands when he sees her. Doc, I didn't mean to. Yes, you did. Her voice is quiet, controlled, but there's an edge to it. You're right. I did. He meets her eyes. I watched that guy talk down to you, treat you like you were nothing. And I couldn't stand it. You saved my life. You saved so many lives. I wasn't going to let him disrespect you like that. Leah's hands curl into fists, then relax. It wasn't your call to make. I know, I'm sorry. She pushes through the door, steps into the cold morning air. Jameson follows her outside. For what it's worth, they would have found out eventually. Maybe, but it should have been my choice. You're right. They stand in the parking lot, traffic building on the street, the city waking up. Leah pulls out her keys. I need to go. Okay. He hesitates. If you need anything, I won't. She gets in her car, starts the engine, sits there for a moment with her hands on the wheel. Her phone rings. Unknown number. She answers. Dr. Grant? The voice is clipped. Military precision. This is Colonel David Reese. I think we need to talk. Her blood runs cold. I'm not active duty anymore, sir. I know, but your name just flagged in a federal database. Someone ran a background check on you, and now I'm getting calls from people asking questions. Who ran it? That's what I need to ask you. What's happening, Leah? She closes her eyes. The past. It's coming back. Silence on the line. Then Reese's voice, quieter than before. It never left. You know that. The line goes dead. Leah doesn't go home. She sits in her car in the hospital parking garage for 20 minutes, hands on the wheel, engine off, staring at the concrete wall in front of her. Her phone keeps buzzing, text messages. She ignores them all. Finally, she gets out, locks the door, walks back inside. She's not on shift, but she can't leave. The ER feels different now. People glance at her, look away quickly when she meets their eyes. Whispers follow her down the hallway. Rachel finds her near the supply room. "You came back." "Yeah." "You okay?" "No." Rachel nods, doesn't push. "I'm here if you need anything." Leah almost says thank you, almost. At 9:47 a.m., everything changes. The call comes in, multiple tones, priority channel, mass casualty incident, gas explosion at a 4-story residential building on the south side, structure fire, partial collapse. First responders on scene report dozens injured, critical patients inbound. The ER transforms instantly. Dr. Patel's voice cuts through the chaos. "All available personnel, trauma protocols. This is going to be sustained. Pace yourselves." Leah's standing in the hallway when a first wave hits. 3 ambulances, 6 patients, burns, crush injuries, smoke inhalation. She watches. Doesn't move forward. Not her shift, not her place. Patel sees her. "Grant, I don't care if you're off duty. I need you." Leah nods once, steps into the flow. The second wave arrives 5 minutes later. Worse than the first. A woman in her 30s, severe burns across 40% of her body, face, torso, arms. Her airways compromised, swelling rapidly. Marcus takes the case. He's trying to intubate, but the anatomy is distorted. Swelling too severe. "I can't visualize the cords." "Swelling's progressing," a resident says, tension in her voice. I know. Marcus adjusts his angle, tries again. The laryngoscope slips. The monitor screams. Oxygen saturation dropping. 88%, 84. Leah's watching from the doorway. Her hands are loose at her sides, but her eyes are tracking everything. The rate of swelling, the patient's color, the time remaining. Marcus tries again, fails. 80%. He freezes, just for a second, but it's enough. Leah moves. "Grant, I've got this. You don't. Move." Her voice is steel. Command. The tone she used in field hospitals, when seconds meant the difference between life and death. Marcus steps aside, shocked into compliance. Leah takes the laryngoscope. Her left hand positions the woman's head with absolute precision. Chin up, jaw forward. Perfect alignment despite the distortion. Bougie. Now. Rachel hands it over without hesitation. Leah threads the flexible guide through the swollen tissue, navigates by feel and experience, follows it with the endotracheal tube in one smooth. The practiced motion. She inflates the cuff, confirms placement with a squeeze of the bag. Chest rises symmetrically. Tubes in. Ventilator. 100% oxygen. Peep at 8. The woman's oxygen saturation starts climbing. 90%. 94. Marcus stares. "How did you?" Next patient. Leah's already moving. The ER descends into controlled chaos. Too many critical cases. Not enough hands. The system is cracking at the edges. Leah moves between bays. Her voice cuts through the noise with calm authority. "That pressure's dropping. Hang another liter of saline. The laceration's arterial. Don't pack it. Clamp and prepare for surgical repair. This patient has a rigid abdomen and falling pressure. Ruptured spleen. He needs OR now." She's not following the hierarchy, not asking permission, just doing what needs to be done. Patel watches from Trauma 2, sees the way Leah operates, the efficiency, the absolute confidence, the way other staff members are starting to defer to her instinctively. This isn't protocol. This is combat medicine brought into a civilian space. At 10:32 a.m., a sound cuts through everything. The deep, rhythmic thump of rotor blades. The entire ER goes quiet. Everyone stops, looks up. A helicopter, landing on the hospital roof. Leah's face goes pale. She knows that sound, knows it in her bones. Patel's radio crackles to life. "Metro General. This is JSOC Medical Transport. We are inbound with priority personnel. Prepare for immediate transfer to your facility." Patel looks at Leah. What the hell is going on? Leah's hands have started shaking. "I don't know." 2 minutes later, the elevator doors open. Colonel David Reese steps out, 52 years old, steel gray hair cut military short, uniform pressed and perfect, eyes like a predator assessing terrain. Behind him, 2 operators in full tactical gear, rifles slung, body armor, Faces unreadable behind dark glasses. The ER freezes. Patients, staff, everyone stops moving. Reese scans the room methodically. His gaze finds Leah and locks on. Dr. Grant. It's not a question. It's a statement of fact. Leah's posture changes. Shoulders back, spine straight. Old training reasserting itself. Sir. The word comes automatically. Reese walks toward her. The crowd parts without being asked. He stops 3 feet away. We have a situation. Federal asset injured during a classified operation. Requires immediate surgical intervention. You're being requested. Sir, I'm not active duty. Requested, doctor, not ordered. His voice is firm but not unkind. I'm asking. Patel steps forward. Her voice is hard, professional. Excuse me, Colonel, but Dr. Grant is currently assisting with a mass casualty incident. Reese turns to her. The temperature in the room drops 5 degrees. I understand, doctor. This is a matter of national security. The asset is critical, time-sensitive. I need someone I can trust. This is my emergency room. Not right now, it isn't. The words are quiet, absolute, backed by authority that doesn't need to be loud. Leah steps between them. Sir, I left. I'm done with that life. Reese looks at her. Something softens in his expression. Just slightly. I know you are. I respect that. He pauses. But I also know you don't leave people behind. Never have. The words land like a physical blow. All the faces flash through her mind. Everyone she saved. Everyone she couldn't. The promises she made. The oaths she took. She closes her eyes. Breathes. Opens them. Where's the patient? Roof. Stabilized but critical. Penetrating chest trauma. Needs a surgeon I can trust with my life. You're the only one who qualifies. Leah looks at Patel. I have to go. Patel's jaw tightens. You're not on duty. You don't have to do anything. Yes, I do. She turns toward the elevator. Stops. Looks at Rachel. For a moment, she considers saying something, explaining. But there's no time. She just nods once. Rachel nods back. Leah walks to the elevator. Reese falls in beside her. Marcus finds his voice. Wait, who is she? Reese stops, turns, looks at Marcus with something that might be pity. She's the reason 47 operators came home alive from situations they shouldn't have survived. He pauses. She's the best combat trauma surgeon this country has ever produced. He steps into the elevator. The doors close. The ER erupts in whispers. Rachel stands at the nurse's station, staring at the closed elevator doors. Holy shit, someone whispers behind her. Rachel doesn't respond. She's thinking about all the small things she noticed. The precise movements, the unshakable calm, the way Leah never flinched. It all makes sense now. On the roof, wind tears across the helipad. The Black Hawk's rotors are winding down but still dangerous. Leah climbs in without hesitation, muscle memory taking over. The patient is strapped to a stretcher. Male, late 20s, fit. Gunshot wound to the upper right chest. His breathing is labored, lips tinged blue. Tension, pneumothorax. Leah's hands move before her conscious mind engages. Needle decompression, now. A flight medic hands her a 14-gauge catheter. She palpates the second intercostal space, finds the landmark, drives the needle through without hesitation. The hiss of escaping air, immediate. The patient gasps. Color floods back into his face. Bag him. We're moving to OR. The rotors spin up. The helicopter lifts. Reese sits across from her, secured in the jump seat, watching. You haven't lost it. Leah doesn't look at him. Keeps her eyes on the patient. I never wanted it back. I know. Chicago spreads below them. Morning light on glass and steel. Leah watches the city shrink. Feels the weight of everything she's been running from catching up. They land at a secure facility 15 miles outside the city. Unmarked buildings, high fences, armed security at every checkpoint. The patient is rushed inside. Leah follows. The hallways are sterile, bright. She's been in places like this before. Different countries, same purpose. The operating room is state-of-the-art, better than most civilian hospitals. A surgical team is already prepped and waiting. Leah scrubs in. The movements are automatic. Hands, forearms. The water runs hot. She watches it swirl down the drain and focuses on nothing but the work ahead. 3 hours. That's how long it takes. The bullet missed the heart by centimeters, nicked the lung, fractured a rib. She repairs the damage with steady hands and complete focus. No wasted movement, no hesitation. When she's done, the patient is stable, viable. He'll recover. She strips off her gloves, her gown, steps out of the OR into the scrub room. Her hands are shaking now. Delayed reaction. Adrenaline crash. She sits on the bench, puts her head in her hands. Reese finds her there 20 minutes later. He's stable. Good work. Leah doesn't look up. Thanks. I meant what I said earlier, about you being the best. I'm not. I just had more practice than anyone should. Reese sits beside her, leaves space between them, respectful distance. Why did you leave, Leah? She's quiet for a long time. When she speaks, her voice is barely above a whisper. Because I couldn't watch one more kid die on my table. Reese doesn't respond, just listens. I did everything right. Every time. Every procedure. Perfect technique. And they still died. Her voice cracks. 19-year-old from Iowa. 22-year-old from Texas. I held their hands while they stopped breathing. She looks up. Her eyes are red, but dry. I couldn't carry it anymore. The weight of all those lives, the ones I saved and the ones I didn't. It was breaking me. Reese nods slowly. He reaches into his uniform jacket, pulls out a folder. You need to see this. I don't want to see anything. I know, but you need to. He hands it to her. She takes it reluctantly. Inside are pages, commendations, mission reports, photographs. Her hands tremble as she reads. Kabul, Mosul, Kandahar. Names of places that still live in her nightmares. You were recommended for the Medal of Honor, Reese says quietly. Twice. Command denied it both times because your operations were classified. Leah stares at the pages. Faces look back at her from photographs. Young faces, grateful faces, people she saved. I don't want a medal. I know, but you deserve to know the truth. You saved 47 lives in situations where survival wasn't supposed to be possible. 47 people went home to their families because of you. And how many didn't? 9. Over 6 years and dozens of operations. You lost 9. The number hits her like a physical blow. She knew it, had counted it herself in dark moments. But hearing it said aloud makes it real in a different way. 9 people who should still be alive. 9 people who would have died instantly without you there. You gave them a chance. That's all anyone can do. Leah closes the folder, hands it back. I can't go back to that. I'm not asking you to. Reese stands. But I am asking you to stop hiding from who you are. Who I am got people killed. Who you are saved 47 lives. Don't dishonor them by pretending you're someone else. He walks to the door, stops. Take your time. When you're ready, there's a car waiting to take you back to the hospital. He leaves. Leah sits alone in the scrub room. The folder sits on the bench beside her. She doesn't open it again, doesn't need to. The faces are already burned into her memory. She pulls out her phone. 7 missed calls, 15 text messages. One is from Rachel. You okay? Leah types back slowly. I don't know. The response comes immediately. That's honest, at least. Leah almost smiles. She stands, looks at herself in the mirror. Same tired eyes, same face. But something's different now. The mask is cracking. The carefully constructed wall between who she was and who she's been pretending to be is crumbling. She gets back to Metro General at 4 p.m. The mass casualty incident is winding down. Patients have been stabilized or transferred. The ER is returning to its normal chaos. When she walks in, the entire department goes quiet. Everyone turns, stares. Marcus, Patel, Rachel, the residents, the nurses, all of them watching. Leah walks to the nurses' station, sets down her bag. I'm back. Patel steps forward. Her expression is unreadable. My office, now. In the office, Patel closes the door, sits behind her desk, gestures for Leah to sit. This time, Leah sits. I made some calls, Patel says. Your file is mostly redacted, but I got enough. Leah waits. 6 years embedded with Joint Special Operations Command, multiple combat deployments to classified locations. 47 confirmed saves in extreme conditions. Patel leans forward. And you just walked away? Yes. Why here? Why this hospital? You could work anywhere. Leah looks out the window. The city spreads below. Ordinary. Safe. Far from the places that haunt her dreams. Because here, no one asked who I was. They just let me work. Long silence. And now they know. Yes. Patel studies her for a long moment. So what do you want? To keep working, to help people without carrying the weight of what I used to be. That's not possible anymore. Everyone knows now. I know. So what do you want? Patel. Elle asks again. Leah meets her eyes. To do the work, however it looks now, just let me do the work. Patel sits back, considers, finally nods. Okay. No more secrets, no more hiding. You're Dr. Leah Grant, former Tier 1 medical officer. That's who you are here now. Okay? And if people treat you differently, you deal with it. You don't run. I won't run. Good. Patel stands. Now get out of my office. You look like hell. Leah almost smiles. She walks back into the ER. Rachel's waiting. You good? Getting there. Rachel nods. She reaches into her pocket, pulls out something small. The coin. Leah's eyes widen. How did you? It fell out of your pocket earlier, during the chaos. Rachel hands it to her. Figured it was important. Leah takes it, feels the familiar weight, the worn edges. It's from my first save, she says quietly. Kabul, 2016. A sergeant gave it to me. Said I earned it. Rachel nods, doesn't push for more. Thank you, Leah says. Anytime. They stand together in the fluorescent light. The ER continues around them. Life and death and everything in between. Leah puts the coin back in her pocket. But this time, it feels different. Not like a weight she's carrying alone. More like a reminder of what she's capable of who she is. Marcus approaches hesitantly. He looks uncomfortable, uncertain. Grant. Holt. I owe you an apology. A real one. Leah waits. I thought you were just lucky. Or reckless. I didn't understand. He pauses. I watched you work today. Really watched. The way you move. The way you think. You're on a completely different level. I just have more experience. It's more than that. And I was wrong to dismiss you. I'm sorry. Leah nods once. Okay. I'd like to learn from you. If you're willing to teach. She looks at him. Really looks. Sees past the ego to the genuine desire to improve. Then watch. Listen. Ask questions. But leave your assumptions at the door. Deal. He walks away. Rachel grins. That was almost nice of you. Don't push it. They both smile. The shift continues. Leah works. She's still the same physician. Still does the same job. But something fundamental has shifted. She's not hiding anymore. Not pretending to be less than she is. It's terrifying. And liberating. Both at once. The first 48 hours are strange. People stare. Whisper. Keep their distance like she's somehow different now. Like knowing her past has fundamentally changed who she is in the present. Leah works her shifts. Keeps her head down. Doesn't engage with the gossip. Just does the work. But the work speaks for itself. On her second night back, a coding patient arrives. Full cardiac arrest. V-fib rhythm. Unresponsive to initial shocks. Marcus is running the code. Following protocol exactly. Compressions, epinephrine, defibrillation. 4 shocks. No response. The rhythm won't convert. Time of death. A resident begins. No. Leah's voice cuts through. She's been watching from the doorway. Now she steps forward. She checks the ultrasound screen. Studies the cardiac silhouette. Sees what they're missing. He has a pericardial effusion. Cardiac tamponade. That's why he's not converting. Marcus looks at the screen. Squints. I don't see. Trust me. She's already prepping. A long needle. Ultrasound probe. Her hands are completely steady. She positions the needle below the xiphoid process. Angles up. Guided by ultrasound and years of experience doing this in conditions far worse than a well-lit trauma bay. The needle penetrates the pericardium. Blood flows back. Dark. Venous. 60 milliliters. The heart decompresses. Suddenly has room to beat. The rhythm converts. Sinus tachycardia. Weak, but present. The patient gasps. Chest rises. The room exhales collectively. Lee. Marcus stares at the monitor. Then at Leah. How did you know? Experience. She strips off her gloves. Walks out. Behind her, she hears Marcus say quietly, "She just saved his life." Over the next week, it happens again and again. A ruptured ectopic pregnancy she identifies before the ultrasound confirms it, just by the patient's pain pattern and vital trends. A spinal epidural hematoma she catches because the patient's reflexes are asymmetric in a way most physicians would miss. A child choking on a toy, complete airway obstruction. She performs a surgical cricothyrotomy in under 30 seconds. Textbook precision under pressure. Each time, the staff watches. Each time, Leah doesn't celebrate, doesn't seek recognition. She just moves to the next patient. Rachel notices the shift. The way residents start asking to work with Leah. The way nurses defer to her judgment even when she's not the attending on record. She pulls Leah aside on day 5. People are talking. They're always talking. No, different talking. They're asking to be assigned to your cases. Leah pauses. What? Residents, nurses, even attendings, they want to work with you, learn from you. Rachel smiles. Even Holt requested you for his next major rotation. Marcus asked to work with me? Specifically requested, said, and I quote, "He wants to learn from the best." Leah doesn't know what to say. She spent 18 months being dismissed, underestimated, given the worst assignments, and now people want to work with her. It feels surreal. At the end of the week, Patel calls a mandatory staff meeting, evening shift. Everyone required to attend. Leah shows up late, stands in the back, tries to be invisible. Patel stands at the front of the conference room. Her expression is serious. "I want to talk about Dr. Grant." Leah's stomach drops. A week ago, information came to light about her background. Some of you have questions. Some of you have opinions. Patel's gaze sweeps the room, hard, unyielding. "I don't care." Silence. "What I care about is this. Since Dr. Grant joined this department 18 months ago, our critical save rate has increased by 18%. Our complication rate has dropped. Patient outcomes have improved across multiple metrics." She pauses. Lets the numbers sink in. "So if anyone has a problem with where she came from, or what she did before she came here, you can take it up with me. Otherwise, I suggest you pay attention, because she's teaching a masterclass every single shift, and you'd be smart to learn from it." The room is dead quiet. Patel's eyes find Leah in the back. "Dr. Grant, anything you'd like to add?" Leah shakes her head. "No, ma'am." Then we're done. The meeting breaks up. People file out. Several glance at Leah, nods of respect, acknowledgement. Marcus approaches as she's leaving. "Grant, wait." She stops. He looks genuinely uncomfortable, like this is costing him something. "I owe you an apology, a real one this time." "You already apologized." "That was for being dismissive. This is for being blind." He takes a breath. "I've been watching you work all week, really watching, and I realize something. You're not just good. You see things the rest of us miss. You operate on a completely different level. I just have more experience in certain situations. It's more than experience. It's instinct, judgment, the ability to stay calm when everything's falling apart." He pauses. "I was wrong about you, completely wrong, and I'd like to learn from you, if you're willing to teach." Leah studies him. Genuine humility, genuine desire to improve. "Stop talking about learning, start watching. When I'm working a case, pay attention to what I'm doing and why. Ask questions after, not during. And leave your ego outside the trauma bay." Marcus nods. "I can do that." "Then we're good." He extends his hand. After a moment, she shakes it. 2 weeks later, Patel assigns Leah to lead a trauma training session. High-fidelity simulation for the entire department. Leah stands in front of 30 staff members. She's never been more uncomfortable. "I'm not good at speeches," Rachel calls from the back. "Then don't give one, show us." Leah almost smiles. "Okay." She runs a live simulation. Multiple trauma scenario. Penetrating chest wound. Tension pneumothorax. Hypovolemic shock. She doesn't lecture. She demonstrates. Her hands move with brutal efficiency. Needle decompression. Chest tube placement. Fluid resuscitation. Each movement precise. Economical. No hesitation. "Speed matters," she says as she works, "but accuracy matters more. You can be fast and wrong and the patient dies, or you can be fast and right and they live." She makes an incision. Clean, controlled, perfect depth. Hesitation kills, but rushing kills too. Find the balance. Trust your training. She completes the scenario in under 4 minutes. The mannequin's vitals stabilize. The room is silent. Then someone starts clapping. It spreads. Within seconds, the entire room is applauding. Leah looks up, genuinely surprised. She doesn't smile, but she nods. Acknowledgement. Respect returned. That night, Rachel finds her in the break room afterward. You look terrified up there. I was. You've worked under enemy fire. Actual bullets and explosions. That was different. How? Leah thinks about it. In combat, I knew my role. I knew the stakes. It was clear. She pauses. Here, people are watching me, judging whether I belong, whether I'm worth learning from. That's scarier than bullets. Rachel shakes her head slowly. You really don't see it, do you? See what? They're not judging you. They're in awe of you. Leah doesn't know what to say to that. At the end of the month, Patel calls Leah into her office. There's paperwork on the desk. I'm promoting you. Attending physician, trauma lead. Leah stares at the papers. I didn't apply for this. I know, but you've earned it. The department needs leadership. You provide that whether you have the title or not. Might as well make it official. I just want to do the work. Then do it. As a leader. Leah picks up the pen, hesitates. What if I'm not ready? Patel looks at her directly. You've been ready. You just didn't want to admit it. Leah signs. That night, she drives home in silence, parks outside her building, sits in the car for a long moment. She pulls out the coin, turns it over in her fingers. The weight is familiar, comforting. She thinks about the faces, the people she saved, the ones she lost, the years of running from who she was. And for the first time in 3 years, she doesn't feel the crushing weight of it. She feels the purpose. The reason she started doing this work in the first place. To help people, to save lives, to make a difference. She gets out of the car, walks inside. The coin stays in her pocket, but it doesn't feel like a burden anymore. It feels like a reminder of who she is, of what she's capable of the lives she's touched, and the ones still waiting. 6 months later, the autumn wind off Lake Michigan cuts different. Colder, sharper. Leah pulls her coat tighter as she walks into Metro General at 7 a.m. Her shift just ended, but she's in no hurry to leave. The ER has transformed. Not the physical space, but the atmosphere. People greet her as she passes, respectful nods, morning acknowledgments. She's no longer invisible. Rachel's at the nurse's station, finishing charting. You're still here? Could say the same about you. Rachel smiles. Touché. Go home, Leah. You first. I asked first. Leah shakes her head, almost laughs. Fine, I'm going. She walks to the locker room. Changes out of her scrubs. Her locker has a new photo now, not hidden, right on the inside of the door. 3 people in tactical gear, faces clear this time. Jameson on the left, a female medic named Torres on the right, and Leah in the middle. Younger, different, but recognizably her. She looks at it for a moment, then closes the door gently. Outside, she stops at the coffee cart. The vendor recognizes her immediately. Dr. Grant, the usual? Yeah, thanks, Miguel. He pours, hands it over with a smile. My nephew's doing great, by the way. The one you treated. Motorcycle accident last month. Leah pauses, places the face. Young kid. Compound femur fracture. She'd set it manually, avoided surgery. The femur fracture? That's him. Orthopedics said you saved him months of recovery time. He's already walking. It was a clean break. Just needed proper alignment. You made it look easy. It wasn't. Miguel waves off her card. Coffee's on me. Again. Miguel, you can't keep doing this. Watch me. She takes the coffee, nods her thanks. She drives to the lakefront, parks near the water, gets out and stands at the edge, watching waves roll in under gray November sky. Her phone rings. She checks the screen. Colonel Reese. She answers. Sir. Leah, how's civilian life treating you? Busy. Good. I heard about the promotion. Trauma lead. Congratulations. Thank you. I'm calling because we're building something new. A transition program. Combat medics to civilian physicians. Helping people like you make the shift without losing themselves in the process. Leah's quiet. We want you to consult. Share your experience. Maybe speak to groups. Help others find their path. I don't have a story worth sharing. Yes, you do. You just haven't told it yet. He pauses. Think about it. No pressure. But these men and women, they need to see that it's possible. That they can be more than what the war made them. I'll think about it. That's all I'm asking. The line goes dead. Leah stands looking at the water, processing. The idea of sharing her story terrifies her. But maybe that's the point. Maybe the things worth doing are supposed to be terrifying. That afternoon, she does something she hasn't done in 3 years. She takes the elevator to the 5th floor. The VA clinic. Jameson's office is at the end of the hall. Door open. He's at his desk, working on a laptop. He looks up when she knocks. His face breaks into a genuine smile. "Doc, this is a surprise. Got a minute? For you? Always. Come in." She sits across from him, looks around the small office. Certificates on the wall, photos of veterans, a prosthetic leg in the corner, backup for the one he's wearing. "I want to help," she says. "Help with what?" "Your program. The transition support. I want to work with your guys." Jameson leans back, studies her. "You're serious?" "Yeah. What changed?" She thinks about it. "I spent 3 years hiding from who I was, pretending I could just be someone else. It didn't work. And if I couldn't make it work, other people are struggling too. Maybe I can help." Jameson nods slowly. "When can you start?" "Whenever you need me." 2 months later, Leah stands in front of a room full of veterans, 20 men and women, all former combat medics, all trying to figure out what comes next. Her hands are shaking. She hides them behind her back. "I'm Dr. Leah Grant. I was a Tier 1 medical officer for 6 years, embedded with JSOC units in Afghanistan, Iraq, Syria. I left the service 3 years ago." She pauses. "And I spent 2 of those years pretending I was someone I wasn't." The room is silent, attentive. "I thought, if I could just hide my past, I could start over, be normal. But you can't start over by pretending you weren't who you were. You can only move forward by accepting it." She talks for an hour about the transition, the guilt, the loss of identity and purpose, about finding work that matters in a different context, about carrying the weight without letting it crush you. When she finishes, a woman in the front row raises her hand, mid-30s, scars on her forearms. "Eyes that have seen too much. How do you deal with memories, the ones that won't leave?" Leah meets her gaze. "I don't deal with them. I carry them. They're part of who I am." She pauses. "But they're not all of who I am. There's room for both, the past and the present. You just have to make peace with that." The woman nods. Something shifts in her expression. Understanding. Maybe hope. After the session, she approaches Leah. "Thank you for being honest." "Of course. I'm Sarah Cross. I've been out for 8 months. Can't figure out where I fit. It takes time." "How long did it take you?" Leah thinks. "I'm still figuring it out, but it gets easier." Sarah nods. "I applied to nursing school, got rejected twice. They said my experience wasn't relevant." Leah's jaw tightens. She knows that feeling. "Keep trying. Find someone who sees your value." "Will you write me a recommendation?" Leah doesn't hesitate. "Yes." That night, she's back in the ER. A gunshot wound comes in. Critical. Chest trauma. Penetrating injury near the heart. Leah takes lead. Marcus assists. Rachel manages lines. They work in perfect coordination. No wasted words. No hesitation. A team that's learned to function as a single unit. The patient stabilizes. They wheel him to surgery. Marcus strips off his gloves, looks at Leah with something like respect that's become routine between them. Hell of a save. Team effort. Still, that was textbook. Leah pauses. Smiles slightly. No, that was experience. At 3 a.m., the ER finally quiets. Leah sits in the break room with a cup of coffee. Actually drinks it this time. Rachel joins her, sits without asking. "You ever regret it, leaving the military?" Leah considers the question, really thinks about it. "Sometimes, there are moments when I miss the clarity, the purpose." She pauses. "But no, not tonight." "Why not tonight?" "Because I'm exactly where I need to be." Rachel smiles, stands. Squeezes Leah's shoulder as she leaves. Leah sits alone for a moment. Then her phone buzzes. Unknown number. "Dr. Grant?" "Yes. This is Lieutenant Sarah Cross. We met at your talk last week." "I remember. I just got accepted to nursing school, and Metro General offered me a position when I graduate. I start clinical rotations next month." Leah smiles. Actually smiles. "That's incredible. Congratulations. I wanted to thank you for showing me it was possible. You did the work." "I just told a story. Silence. Then Sarah asks quietly, "Will you be there when I start?" Leah looks around the break room. The familiar space. The hum of the ER beyond the door. The work that never ends. The lives that keep needing saving. "Yeah, I'll be there." She hangs up, stands, walks back into the ER. The fluorescent lights hum. A monitor beeps steadily. Someone's calling for assistance down the hall. She responds, because that's what she does. That's who she is. Not just who she was, not just who she's becoming, but all of it. The combat medic and the civilian physician. The past and the present. The weight and the purpose. For the first time in 3 years, she's not running from any of it. She's just living it. And that's enough. The ER doors open. New patient incoming. She moves toward the bay. Ready. The work continues. It always does. And so does she.